And towards the end of the presentation, we're going to really focus in on how genetic counseling applies to cancer and cancer genetics.
And as you can note that there's closed captions at the top in case you need to refer back to whatever we're saying or you're not sure what we said. But this is automatic, so there might be a little bit of errors. So we do apologize for that in advance. And my name is Karina Chua.
And I'm Camilla. So before we go any further and talk about the specifics of genes, we thought it was important to make sure we're all on the same page and we all know what genes actually are. So this picture may take some of you back to a high school biology class. We're just going to review some of the fundamentals right now. You may have heard at some point in your life people say things like, our body is made up of cells. Well, that's relevant because inside our cells, we have our chromosomes. And I like to think of our chromosomes as suitcases for our genes. So when you zoom in on a chromosome, kind of like what's happening there in the center of the picture, you will see a lot of genes packed along it. And that's what that image is showing. So, now that we know that chromosomes are packed with genes, we can take it one step further and ask, well, what are genes made up of? And genes are made up of DNA. And that's kind of what it's showing you there on the top right. So, with that information, you may be wondering, well, where do we get our genes from and what determines our genes? We get our genes from our parents. So, as humans, we have 2 copies of every gene. We get 1 copy of our genes from our mom and 1 copy of our genes from our dad. So, we are literally 50% each of our parents. And that's how we end up with the genetics that we have. So now that you know where our genes come from, what are genes? Well, I like to think of genes as instructions for the body. Each gene has its own function or its own job. So on the left, you see a cartoon version of someone's chromosome, and it's showing different genes along that chromosome. So you can imagine in the center of the photo where it's showing that blue strand, you can imagine that showing you a strand of DNA that corresponds to the gene for eye color. And changes or differences in that gene will change how that gene is expressed. And then those genetic changes will determine if someone has blue eyes or brown eyes or green eyes. And then, below that, you will see that red strand of DNA. And you can imagine that's referring to gene for hair color. And changes in that gene will change gene expression and determine someone's hair color. So we all do have differences in our genetics, and that's how we get diversity, and that's why we're all a little different. If we all had the same genes and the same genetics, we would all be identical twins, and that would be weird. So having different genetics is normal and it's expected. However, sometimes certain genetic changes can lead to a gene being expressed incorrectly, or certain genetic changes can lead to a gene just not working properly anymore. And those are the kind of gene changes that can lead to someone developing a disease. And, before we go any further, we thought this would be a good place to clarify that the terms genetic change, genetic mutation, and genetic variation are used interchangeably. They're all referring to changes in the gene. Karina and I prefer to use the terms genetic change instead of genetic mutation, but you may have heard or seen in some images the term genetic mutation. I think one slide back, Karina. Thank you. So genetic changes is kind of really where the medical world and the genetic world collide. So we study genes because differences in genes that we're born with can actually be very informative of certain diseases. And some genetic differences, I'm just going to go through the image you see here on the right. Some genetic differences can help diagnose someone's disease. Some genetic differences can pinpoint genetic factors that cause the disease. Some genetic testing can predict how severe someone's disease will be. They can help choose a medication based on a person's individualized genetics. Genetic testing can discover genes that can be passed on to children, so it's important for family testing. Genetic testing can identify diseases in babies to do early intervention screening. So every state has a newborn screening program where they test newborns in hospitals for conditions, and many of those are genetic conditions that are amenable to early intervention. And so as you can see, that's a lot of information packed into genetics. And so who's going to help with understanding all of this information? So that's what Karina is going to tell you a little bit about.
Yep, so basically why we're here is to talk about what a genetic counselor does. So a genetic counselor is a health professional with specialized training in medical genetics and counseling. And genetic counselors have a master's degree in genetic counseling and are certified through the American Board of Genetic Counseling. Like other health professionals, we must participate in continuing education to maintain our certification. And genetic counselors really play an important role as patient and family advocates, where they are responsible for providing not only relevant information, but also support in decision making and referrals. And overall, genetic counselors serve as translators of genetic information because these can sometimes be overwhelming for families in the midst of receiving a life-changing diagnosis. So the diagram on the right really shows the different specialties that genetic counselors play an important role in. So historically, due to the fact that genetic testing was not as common as it is now, and because we really initially had a limited understanding of how genetics affect health, genetic counselors were mostly in prenatal genetics. As we gain a better understanding of how genetics affect health, the services of genetic counselors can be seen in a wide variety of specialties, such as neurology, pediatrics, and even pharmacogenetics, which is related to the study of how our genetics can affect our response to drugs. Now that we've given a brief overview of who genetic counselors are and where their services may be found, we'll dive deeper into what a genetic counselor does. First and most importantly, genetic counselors are passionate about helping their patients understand what their genetic test results mean. And to do that, we talk about genetics a lot. Kimia has already given you a taste of what the education portion might look like, so what genes are and why they are important. However, just because we love genetics, it does not mean, we would really want to emphasize, as you notice in the figure on the right, that genetics often do not explain everything. While there are a few genetic conditions that are truly a result of genetic changes in a specific gene, most medical conditions are a combination of many factors. Your genetic information plays one part, but there are also environmental factors and individual choices like diet and lifestyle. So now you must be wondering, how do healthcare professionals know whether a condition I have is genetic? There are actually two types of genetic changes. So one that can be passed from generation to generation. So what we would call something, maybe you would say running in the family, and also a genetic change that happens only in the person with the condition. In both of these types, it is important to identify what they are because they may impact the patient's medical management. So the most effective method that genetic counselors use to determine if a gene change is being passed from generation to generation is by taking what we call a family health history. And in your initial genetic counseling appointment, the genetic counselor will often spend time asking about each family member, especially the ones most closely related to you. And these information will be written in the form of a pedigree or, as you can see here, what looks like a family tree. So very similar to a family tree that some of you may have done before in elementary school. A family health history is essential in providing an accurate and informative assessment of how likely someone is to, for example, develop a specific type of cancer. So on the right in this diagram here, the arrow is pointing to whoever the genetic counselor's focus is on as the patient. Squares show biological males and circles show biological females. And the lines indicate the relationship between individuals. So if this were your pedigree, for example, moving upward from you would have your mom and dad here shown, and then horizontally we have siblings, and below that your children, and so on. And then the numbers in the squares and circles represent the degree of relationship from you. So one representing first degree relatives, two second degree relatives, and so on. Oh, and this is an example of a pedigree. I believe this is from a pediatric setting. As you can see here, the patient of interest is a 6-year-old boy. As you can probably tell, there are a lot of different symbols that can be used in an actual pedigree to represent the different relationships that a family may have. And this figure here is not to overwhelm you, it's just to highlight that although genetic counselors take down a lot of information, what we are really looking for are patterns that would give us a reason to offer genetic testing. And we will talk about why that is important in a bit. So information on multiple generations in this pedigree, there are 3 generations shown here, helps to demonstrate inheritance patterns. So for example, hereditary cancer is something that may be inherited either from the maternal, so mom's side, or paternal, dad's side. And by drawing the information out, it is easier for both the genetic counselor and the patient to understand the patient's chances of developing a specific type of cancer in their lifetime.
So once a genetic counselor takes a personal and family health history, um, thank you, Karina. Once a genetic counselor takes a personal and family health history, the genetic counselor then needs to analyze if there's actually any indication or need for genetic testing. As we've said before, many conditions are sporadic or due to environment, so not everybody needs genetic testing. However, if a genetic counselor looks at the family and personal health history and decides that genetic testing is appropriate, there's still a few things left to coordinate. It's important to note that it's not helpful to just offer all sorts of testing to every patient. For tests to be covered by insurance, there needs to be testing of relevant genes and conditions, and insurance coverage is very important to patients. So genetic counselors really do comply by the set out guidelines. But finances put aside, genetic counselors really only want to test and look for results that can be informative or helpful to the patient. So, if you remember from earlier, we discussed that many genetic changes are normal, and genetics is still a new and growing field. So, we don't fully understand all the genetic changes. So, right now, we really only test for changes that we know are for sure associated with certain conditions or diseases. And typically, genetic counselors really try to do targeted testing instead of just testing every possible gene. And lastly, once a genetic counselor knows what genes and conditions should be considered for testing, the genetic counselor must decide what's the most appropriate lab to do the testing. Some genetic changes are harder to detect than others, and they require more advanced testing techniques. So it's important for genetic counselors to know how to account for what kind of test should be done for the specific disease or condition in question. And once all of that has been decided, a genetic counselor will offer genetic testing to the patient. And a patient can choose to either accept or deny to do the genetic testing. And once the patient does accept to do the testing, they usually have the choice of giving either a blood sample or a saliva sample. Now, with the COVID pandemic going on, it's become more common to just have a saliva kit mailed to the patient's house, and the patient can just collect their own saliva and then mail it directly to the lab. So it will take 4 to 6 weeks for the results of a genetic test to come back usually. And once the results do come back, there's often a lot of communication that needs to be done to explain the results. And I'm just going to walk you through the 3 different kinds of results you can see in a genetic setting. So if someone gets a negative test result, that means that no genetic change was associated or no genetic change associated with the disease or condition was found. So then the genetic test was essentially normal. Sometimes people are relieved to get a negative genetic test result, But that's not always the case. Sometimes people have a disease or condition and they're hoping to find something on that gene test as an explanation. So getting a negative result can be disappointing sometimes. And moving on to the next category, someone could get a positive result back, and that means that there was a genetic change associated with the condition found on the genetic test. And this usually requires the longest conversation and consultation with a genetic counselor. So if someone tests positive for a gene that causes blindness, well, then this person will now need to change their screening and their medical management because it is now known that they carry this genetic change, which will contribute to blindness. And likewise, this person may want to tell their other family members about their test results since we all share genes with our family members. And that's something a genetic counselor can also facilitate and work with during positive testing consultations. And the third kind of result we often see in genetics is called a variant of unknown significance, shortened as a VUS. What that literally means is that the genetic change found or the variant found is just unknown to be either disease causing or benign. So it means that the lab found a genetic change, but the lab cannot say if that's a positive or negative result. So it just gets classified into this third category of VUS, which stands for variant of unknown significance. As we mentioned earlier, everyone has unique genetics, and differences in our genetics is normal and expected. And because genetics is a growing and newer field, sometimes the labs and researchers just aren't able to definitively say which gene changes are associated with disease or not. So that's why the VUS category was created. It just gives scientists and researchers time to study certain genetic changes before classifying them as positive or negative. However, you can imagine that getting a VUS test result can create anxiety in some patients. And that's why we go back to the last slide in terms of saying we really try to only offer appropriate testing and targeted testing. And we don't like to just test every single gene because the wider net we cast with genetic testing, the more likely we are to find something we don't know about, something like a VUS. And that can create unnecessary confusion, and that's why, as genetic counselors, we really try to be precise with our testing. So, as you can see, there's a lot of information involved in a genetic counseling session, and it can be overwhelming for patients at times. So, besides being experts in genetics, genetic counselors are highly trained in supporting patients emotionally and psychosocially, and just really being a true counselor. So, genetic counselors can facilitate difficult conversations within the family, such as if someone receives a positive test result back and there needs to be conversing amongst the family about how this affects others. Genetic counselors can set up referrals to other specialists to get on board. Genetic counselors can discuss future steps that should be taken, such as changes in management due to a test result. And genetic counselors in general will just be available for follow up. Genetic counselors usually give their patients a written information letter, which we call a patient letter. These letters document a summary of the appointment, so like a summary of your family history, a summary of genetic testing options discussed, and a summary of the test results once they come back. Patients like to have these patient family letters from genetic counselors because it's just something that patients can refer to in the future in case they or their future doctors have questions about their genetic testing. And in some situations, people can qualify for research or screening studies based on their genetic test results, and genetic counselors can provide information about those studies or clinical trials to their patients. In the long term, genetic counselors continue to be a resource for their patients even after the appointments. So now we would like to transition into talking about genetics of cancer specifically. So just to take an overlook, this slide shows us the causes of cancers. As you can see, the majority of cancers, 70 to 80%, are due to sporadic cancer. This means that the cancer was random and likely caused by something in the environment. The next piece of the pie we see shows that 15 to 20% of cancers are classified as familial cancers, What that means is that these are the kinds of cancers that are caused by a combination of both genetic factors and the environment put together. But in the last piece of the pie, we see that 5 to 10% of cancers are caused by genetic changes or genetic mutations that someone is born with. Certain specific genetic changes really can set someone up to get cancer, and that's what we see in those 5 to 10% of cancers labeled as hereditary cancers. This is indicating that someone inherited genes with genetic changes that set them up to be at a higher chance of developing cancer. But it's important to note that only applies to 5 to 10% of cancers. So most people who have cancer do not fall into this category. But of the people who do fall into that category of having inherited genetic changes associated with cancer, those people are at a significantly higher chance of getting cancer. And that's why we as genetic counselors, we really care to try and identify those people early on through things like genetic testing, because the goal is to do early screening and early intervention if possible. And that's something that we'll talk about a little bit later as well. So these tables are here just to show you that there is growing awareness about the many genes that we have in our body that can have genetic changes associated with a higher risk of developing different kinds of cancer. The list of genes here are genes with potential changes that range in its association to cancer. So some of these genes are strongly associated with developing cancer. Some of these genes with genetic changes are more moderately associated with developing cancer. These tables are broken up into different cancer categories such as lung, colorectal, ovarian, breast. But if you look closely, you can see that many of the genes overlap between the tables. So there are genes with genetic changes that could contribute to many different kinds of cancers. So for example, mutations in the KRAS gene can contribute to lung cancer, colorectal cancer, and pancreatic cancer. So there is overlap with the genetic changes and the cancers they can contribute to, but some genes and their genetic changes are very well understood and really only contribute to specific cancers. And Karina will tell you about some of those well-known examples next.
So, some of you may have read Angelina Jolie's article in 2013 about her choice to undergo testing for the BRCA1 gene, where a gene change was found in her BRCA1 gene, and that led to her increased chance of developing breast and ovarian cancer. Because of this, the BRCA1 and BRCA2 genes are probably the most widely known genes associated with cancer, which has led to some misconceptions about what this means in general. So, you may have heard people say, oh, I should get genetic testing to see if I have the BRCA or BRCA genes. Since we have made everyone here today listen to our Genetics 101, you might have noticed something odd with that sentence. Because we're all humans, we all have these BRCA1 and BRCA2 genes located here on our lovely chromosomes. What genetic testing is really looking for is changes in the gene that has been shown to cause a higher likelihood of developing cancer, which is something a genetic counselor would be more than happy to go over with a patient. And now we're just going to kind of take a little bit of a you know, a little bit of a break from listening to Kimia and I, and really listen to someone else talk a little bit about his own experience with getting genetic testing and finding out that he has cancer. And some of you may have heard this news before, but this really is Beyonce's father. And I honestly think like after watching that little segment that he did, he is a much better genetic counselor than some of us. So he really breaks it down and just kind of advocates as well for the lesser known case of male breast cancer.
To share, Michael, is that I also am a survivor of breast cancer.
Just 2 months ago, Knowles noticed a small recurring dot of blood on his shirt.
And then I told my wife, and she says, you know what? I saw a dot of blood on the sheets. So I immediately went to my doctor. I got a mammogram, and then it was very clear that I had breast cancer.
When you get the diagnosis that, yes, you have breast cancer, what goes through your mind?
Of all the things I could get. Why would I get this? From a man's perspective, I'm thinking, why me?
Only 1% of breast cancer diagnoses are men. What have the doctors told you about your diagnosis?
So I have that BRCA2 that's mutated, which means I have four things to be concerned about: prostate cancer, pancreatic cancer, melanoma, and breast cancer. The rest of my life, I have to be very much aware and conscious and do all of the early detection, constant mammograms, constant prostate exams, constant MRIs for the rest of my life.
Luckily, he found it early. How are you doing?
I'm doing really good, Michael. I had my surgery the last week of July, and now doing all the steps for recovery.
You go through this, but you don't go through it alone. You have a family. So
Right.
how did they handle it?
Well, the first call was to my family. That was the very first call because this is genetics. It also means that my kids have a higher chance, a higher risk. Even my grandkids have a higher risk. And they handle it like they should. They went and got the test.
Noel said cancer changed his outlook on life.
I stopped drinking. I wanted to just have a clean bill of health, do things, exercise, meditate. Things that used to be important, Michael, are not important to me now. Just look at the world differently.
Today, he is urging everyone to do the same, especially.
Yeah, so that really just really nicely sums up, how we feel about, whenever someone in the family, especially when it's not expected, for example, male breast cancer or breast cancer or cancer in general at a very young age, it would be something that, a genetic counselor can then go over a family history and really determine who are the best individuals to next test so that they are also aware and can get early screening. And so genetics really is, oh, sorry. So with the information that we currently have about genes, when it comes to genetic testing, a genetic counselor can work with you to choose the size of gene panel that would best fit your needs. So gene panels are really a compiled list of genes that a lab can examine for gene changes. It can range from a very specific panel with 2 genes all the way to what we call a multi-cancer panel, which will examine more than 50 different genes. This is just an example of the types of panel that can be offered to someone with a suspected family health history of hereditary breast and ovarian cancer. But it's important to note there are many different types of panels. And the bigger the panel, the more we are looking broadly at genes that are associated with many different cancer types. And as Kimia had talked about earlier, how big of a panel to choose is a decision that you can make together with a genetic counselor because they'll, make sure they take your decision making into consideration, what you want and what your, anxiety over uncertainties are. And so overall, really, genetics is a science that is constantly changing as technology improves and we gain a better understanding of the role genetics play on our health. In the future, more genetic test results will be considered medically actionable, which means that the results will not just be a question mark or an inevitable fate, but something that doctors can use to improve medical outcomes for the patient. We are also optimistic that as genetic testing becomes more affordable, access to testing increases, which is important if equitable healthcare is to become a reality. The end goal is really for personalized medicine, which allows doctors to tailor treatments based on a genetic understanding of the patient's condition and unique genetic makeup. And the diagram on the right is really just showing us, some of the advances that we have had in the last few years with genetics. And so we are really excited and glad to have talked to you about who genetic counselors are and how they can help. As of 2015, there has been a dramatic increase in the number of genetic counselors in the US, and this has increased accessibility to genetic counselors, especially with phone and video counseling. Many genetic counselors are also taking on roles in research, patient advocacy groups, and diagnostic labs, as we become more aware of the need for genetic education for patient empowerment. And here are some screenshots, just really of very recent news that are bringing genetic counseling to the forefront of healthcare rather than an afterthought. And as a, again, quick summary, a really great summary, and this is a video by the National Society of Genetic Counselors. They really talk about the same things we've talked about in the previous slides, just with a little more animation, and hearing it from a different voice might also help get your solidify some of that understanding.
Have you seen the term genetic counseling in the news lately? Or maybe your physician has referred you to a genetic counselor and you're not sure what's next? You may have questions about genetic counselors. What do genetic counselors do? When should I see a genetic counselor? What happens during an appointment with a genetic counselor? Genetic counselors have specialized education in both medical genetics and counseling. This prepares them to give you the personalized help you need when it comes to your genetic health. Today, there are thousands of genetic tests, and the number of tests available grows each year. How do you know whether a genetic test is right for you and what the results mean? Using their genetics expertise, a genetic counselor can work with you and your physician to understand your genetic risks, the tests that may be right for you, and what genetic test results may mean for you or your family. With their expertise in counseling, a genetic counselor can also provide emotional support as you make decisions and empower you with information for your overall health care. Genetic counselors can partner with you, your primary physician or specialist, and your entire healthcare team to integrate your genetic information into your overall healthcare or medical treatments. Genetic counselors work in a wide variety of medical specialties. Genetic counselors help and support patients for a variety of reasons or situations. Maria and Tim's son was diagnosed with autism. They want to know if there is a hereditary link in their families and whether any additional children may be at risk of developing autism too. Susan's mother and aunt were both diagnosed with breast cancer at a young age. Her doctor has recommended genetic testing to determine her risk for inherited breast and ovarian cancer. Linda and Joe want to start a family and they have some hereditary conditions in their family history. They would like to meet with a genetic counselor for pre-family planning to determine the level of risk for their children. After you make your appointment, you can start to prepare. Think about questions you have for your genetic counselor. Outline your family's history of health conditions. Note any questions you have about inherited risks. Think about any of your lifestyle factors that might impact your health. At your appointment, you will review your questions, family history, and inherited risks. Your genetic counselor can help you and your physician determine whether any genetic tests may provide additional information, identify the best testing options for you, and will help you understand what those test results may or may not tell you. You will also review how the results may be used along with healthcare and support options based on possible results. If you do move forward with genetic testing, your genetic counselor can help you understand what to expect. Many genetic tests are done through a simple blood sample. Once your test results are ready, your genetic counselor will help you interpret the results and what they mean for you and your family. They may discuss follow-up tests that could be ordered based on your results, or you may need to schedule follow-up appointments with your genetic counselor. You may talk about any medical or lifestyle options or family planning. To learn more about how genetic counseling could benefit you and your family, visit findageneticcounselor.com.
Yep. So this kind of as we conclude our presentation on what genetic counselors are and our just brief introduction to genetic counseling, we encourage you to check out the National Society of Genetic Counselors Find a Genetic Counselor tool, and the link is included here for your reference. We can also send that out to Rachel. To start your search, you first select whether you're looking for in-person or telehealth genetic counseling, which will then bring you to a form when you fill out your preferred location. And then a list of genetic counselors within the area will be shown with their contact information and where they currently serve as a genetic counselor. And just important note that the NSGC Find a Genetic Counselor Directory does not function as a referral service, but it really provides you with information that you can use to either contact the genetic counselor directly or take to your provider to request for a referral. Just kind of a side note as well, when I was going through this myself, I noticed that if you click on telehealth, there might be a more limited option. But even going through the in-person directory, there are some genetic counselors that list that they are also available to do phone interviews or phone genetic counseling appointments. So you can try to check out both as well if you're not finding what you need. And with that, we really, would like to thank you for your time and see if you have any questions.
Well, thank you so much, Kimia and Karina. This was so informative. And the presentation was also so easy to understand for a layperson like me. There are some questions that came through the chat, so I'll ask a few of those. And I also invite people to unmute themselves if you want to ask a question out loud. But there are a lot of questions around the affordability of genetic testing. Like, does Medicare, Medi-Cal pay for genetic testing?
I'll take that one on. So if your like oncologist or genetic counselor determines that you are eligible for genetic testing, Medicare and Medi-Cal should pay for the genetic testing or just have like your typical copay you would have with the lab. However, that is something that you should like verify with your oncologist or genetic counselor who will be approving your genetic testing.
Okay. And then another question, there are free genetic testings I've seen on Facebook. Are they safe? Are they recommended?
Sorry, Rachel, did you say free?
Yeah.
Oh. We're not 100% sure about that because usually when we think about genetic testing, we do recommend going through labs that have been certified. So I think off the top of my head, one lab I can think of that you might have heard of is Invitae. But these kind of labs are typically, they prefer to go through providers or genetic counselors to get those testing done. So I don't know if I can speak to what those free genetic testings are on Facebook.
Yeah, no, I think that's great advice. Just due diligence and do some research and make sure it's a certified testing center. So that's very helpful. Another question, how many family members need to have cancer for someone to get approved for genetic testing?
It really depends on the kind of cancer in question. Different clinics have different guidelines, but for example, a lot of clinics follow the guidelines of the NCCN, and for something like pancreatic cancer, if just like one first-degree relative had like metastatic pancreatic cancer, you typically will be approved for genetic testing, but that's one of the more extreme examples. For things like breast cancer and some other cancers, it really has a more complicated way of getting approved. And that's where like that family history and personal health history come into account. And the specifics are more up to a genetic counselor to determine.
Great. And is there gene testing for sarcoma cancer, specifically gastrointestinal stromal tumor?
I'm not familiar with that. Karina, are you?
We know that there are some sort of hereditary patterns that we can see with frequent sarcoma cancers that's seen in the family. But we wouldn't know exactly what sort of genetic testing to be done, just because we aren't certified genetic counselors yet, and also we really want to make sure you are being seen comprehensively or heard comprehensively. So we would prefer if you refer to your provider or find a genetic counselor, because we don't want to give like a specific medical advice that might be taken the wrong way here.
Sure. And then this is an interesting question. How valid are the testing done with 23andMe and other ancestry sites? Also, what are the problems that may arise out of that testing?
I think Karina and I could both speak to this question because this is such a good question. I'm sure we have both have our opinions. 23andMe and Ancestry and those companies, their techniques and their level of expertise is great for things like ancestry and like finding out your heritage. But for things like genetic changes associated with like illnesses or like diseases, such as like genetic changes associated with breast cancer, in my opinion, the technology 23andMe and these companies use is not comprehensive enough, and it's not the most like robust genetic testing technology out there. So typically, it's not recommended to use those kind of companies for medical genetic screening. For medical genetic screening, it's definitely better to go through your provider or a genetic counselor. And the problems that may arise from using companies like that is you can get false positives and false negatives. So a false negative would be they tell you that you don't have any gene associated with uh, genetic changes associated with breast cancer, but you actually might, and their testing just isn't robust enough to detect it. And I'll turn to Karina for anything else.
No, I think Kimia really summed up really well what 23andMe is a certified lab, and they are trying to get those FDA approvals to provide more clinically relevant genetic testing. But I guess one of the things like off the top of my head that I can think of specifically are things like maybe you would say BRCA testing. So they do offer those kind of tests, and they would tell you whether or not you are at an increased chance of developing breast and ovarian cancer. But then it really is kind of the fine print of the little tiny print there that says they really only test for specific founder mutations, which are only found in certain ethnic groups and certain populations. So then that might kind of lead to a little bit of a misunderstanding on the patient's point of view.
Very interesting. Thank you both. And as a follow-up to that, what are the problems with testing in general? Or could there be an impact to life insurance costs, for example?
That's a really good question. And I think it's something that is really, I guess, like it's on the forefront of everyone's minds. And when we think about testing, there are a lot of really small details with insurance, but overall, we would say that in terms of like workplace insurance or employer insurance, those are not, they're not able to access the information. But I think when it comes to life insurance, I think that is something that legally that is still not covered under the protection of genetic information. So that is something to also discuss with a provider, anyone really who is, well aware of having seen patients with that kind of dilemma before, and they'll be able to better help you with that.
Yeah, it definitely sounds like a kind of cost benefit analysis there, right?
Yeah, and going off what Karina said, um, if you have life insurance and then you're tested for a genetic change associated with the condition, they can't, retroactively take your life insurance away. But if you get your positive genetic test result before you buy life insurance, then you could be qualified from life insurance. So the order of how things are done should be taken into account.
And are there any other entities that can access the results of the testing?
It gets kind of complicated. There have been, like for companies like 23andMe, for example, there have been cases of like police and stuff being able to access some genetic testing results to like solve crimes and stuff. When it comes to medical labs and the genetic testing done through medical labs, that's less of an issue. But there is always fine print. But genetic health is just like any other health information that it's very strongly protected under HIPAA. So it shouldn't be easy to access by other people if it's done in a medical setting.
Great. And those are all the questions on chat. I'm not sure if anybody else has any remaining questions. You're welcome to unmute yourself and ask them if I missed something.
Did we cover the Medicare, Medi-Cal question?
We did, yes.
Oh, sorry.
Well, that's okay. It's a lot of information to absorb, and I'm really thankful that we recorded this workshop so we can also post it to our website so we can all go back and review, because this is just so helpful.
I sent a question, but I guess I might have sent it to someone specifically by accident. But it's kind of a different question. I went through this with my mother, and I'm actually interested in becoming a genetic counselor. So I was wondering if anyone would willing to do like an informational interview, like on your experience.
Oh yeah, I think Karina and I would both be interested in that. That's like, we love talking about genetics and genetic counseling. So we'd be happy to answer any questions you have.
Thank you. Is it okay if I just send my email through the chat? Okay, thank you.
Make sure you do it privately so that not everybody has your email. But thank you, Kimmy and Karina. That's very thoughtful. All right. Well, I think those are all the questions. So just again, want to thank you so much, Kimia and Karina. This was so informative and helpful. And we just really appreciate all the thought and preparation that you put into preparing this, as well as all of your generosity in answering questions at the end. So thank you so much, everybody. And if you wouldn't mind sticking around just one extra minute, we do have a workshop evaluation, and this just helps us understand what you want to see more of at CSC. So if all the attendees could hang out just one more minute to take that poll, that would be great. And thank you again, Kimmy and Karina.
Yeah. Thank you. Thank you. I learned a lot. Thank you.
And I am not able to launch the poll. Lee, Miranda, are you able to launch the poll?
Let me try.
Not.
I think I did.
Okay.
Yes.
Thanks.
Did I?
Yeah.